Welcome to Tutorial Zone, where we simplify complex concepts. This video is part 3 of the Introduction to Basic Human Anatomy and Physiology. Without wasting much of your time, I am Dr. Said Piri, so let us begin. By the end of this video, you should be able to do the following. You should be able to describe the anatomical position, relate the anatomical names and the corresponding common names for various regions of the human body, define the anatomical planes, anatomical sections, and directional terms used to describe the human body, outline the major body cavities, the organs they contain, and their associated protective linings. Why is it important that we have to discuss these anatomical terminologies? It is important to discuss these anatomical terminologies because healthcare professionals and scientists use these anatomical terminologies to describe the positions of body organs in the human body. This is important because it helps prevent confusion during communication. So these body structures are usually described in a standard reference position, and this standard reference position is known as the anatomical position. So what is the anatomical position? In the anatomical position, the subject is standing erect. They are standing erect. They are facing the observer. So the head is facing forward. The eyes are facing forward. The head is also level. And in this anatomical position, as the subject is standing erect, the upper limbs or the hands are on the sides like this. As you can see from here, the hands are on the sides and the palms are facing forward. The palms are facing forward and the feet are lying flat on the floor, parallel to one another as well as facing forward. So that's what anatomical position is, and you have to understand that everything that is going to be described in anatomy and physiology, they are going to be described, every body organ described is going to be described in relation to this anatomical position, where the subject is standing erect, head level, eyes facing forward, the upper limbs are on the sides, the palms are facing forward, the feet are on the floor and parallel to one another, and as well as facing forward. Then the other terminologies of interest are supine and prone position. These two, supine and prone position, are used to describe a body that is lying flat. If this human being is lying flat and is facing upwards, we say that this body is lying in supine position. But when the body is facing downwards, we say this body is lying in prone position. We'll start by looking at directional terms. What are directional terms? Directional terms are anatomical terminologies that are used to describe body structures in relation to one another. So the first directional term that we're going to look at is superior. So the word superior means above or on top or towards the head. So when we say one structure is superior to another structure, we mean it's either above or on top of that structure, or it is closer to, or it is towards the head, it is closer to the head. Then the word inferior means below or at the bottom or away from the head. So when we say a structure is inferior to structure A is inferior to structure B, we mean that this structure is at the bottom of structure B or below structure B or away from the head in comparison to structure B. Structure B is closer to the head or structure A is away from the head. The other pair of directional terms include anterior, also known as ventral, and posterior, also known as dorsal. So a structure that is anterior is nearer to or at the front of the body. So the front of the body, you can say it is anterior. When you say the structure A is anterior to structure B, what you mean is that structure A is nearer to the front of the body in comparison to structure B. Then posterior or dorsal means nearer to or at the back of the body. So the back of the body is a posterior, and if a structure is posterior to another structure, it means it is nearer to the back of the body in comparison to that other structure. The other pair of directional terms that we have to talk about include proximal and distal. So proximal means a structure is nearest to the origination of another structure. For example, the humerus is proximal to the radius. The shoulder joint is proximal to the humerus. Then when talking about distal, you mean that a structure is further away from the origination of another structure. The best example I can give here are the fingers. The phalanges are distal to the wrist joint there. The other pair of directional terms include superficial and deep. So when you're saying the structure is superficial, you mean it is closer to the surface of the body. When you say it is deep, you mean it is towards the core of the body. So for example, here the lungs are deep, okay? And then the muscles here, as you can see, they are superficial to these lungs here, to the heart. The heart is deep to these muscles that are present on the superficial aspect of the body. As we move deeper into this lecture, we're going to talk about serous membranes. So those serous membranes are going to have two parts. When you're talking about those serous membranes, the two descriptive terms that are in relation to those serous membranes will be visceral and parietal. So for example, if this is a body cavity, it is a space where you find the organs in the body. So let's say this is our organ in the body. The membrane that is going to cover this organ, the membrane that is going to cover this organ is known as the visceral layer. So pertaining to a covering over an organ, that membrane that is covering an organ is known as the visceral layer. Then the membrane that is going to cover the walls of the cavities, the inner walls of the cavity where that organ is located. So this is our organ. This membrane is known as parietal. So pertaining to covering against the cavity wall, that layer or that membrane is known as the parietal layer or membrane. The other anatomical terminologies that haven't been discussed this far include medial, lateral, intermediate, ipsilateral, and contralateral. So when you're talking about medial and lateral, it is important to understand that if this is the human body, we can draw a vertical imaginary line that is passing at the middle of the body, dividing it into equal right side as well as the left side. So dividing into two sides that are equal. If a structure is closer to this imaginary line, we call that structure, we say that structure is medial to another structure. The best example is the ulna and the radius. We're talking about the upper limb, we're going to talk about the ulna, which is one of the bones in the forearm, and then the radius, which is another bone here. So this structure, because it is closer to this midline, it is closer to this vertical line that we have drawn, so that the ulna is medial to the radius. Then the other structure, the other anatomical terminology is lateral. Lateral means far from the midline. So if a structure is very far from this midline, we use the word lateral. For example, the radius is lateral to the ulna, or the heart, for example, is closer to this line here, but the lungs are on the other side here. So you say that the lungs are lateral to the heart. Then ipsilateral and contralateral. For ipsilateral, we say it is defined as or it is used when the structures are on the same side of the body. So for example, the left side, the left hand is on the same side as the left leg, or the left upper limb is on the same side with the left lower limb. So those two structures are ipsilateral, they are on the same side. The other way that has been used here, the other example that has been used here is the gallbladder and the ascending colon are ipsilateral, so meaning they're on the same side of the body. The word contralateral means that they are on the opposite side of the body. The ascending colon and the descending colon are on different sides of the body, so they are contralateral to one another. These are some of the terminologies that were not discussed this far. Let's talk about the different regions of the human body. The principal regions of the human body include the head, the neck, the trunk, the upper and the lower limbs. The head is made up of the skull, the cranium, as well as the face. The neck is there to support the head and attach it to the trunk or connect it to the trunk. The trunk is made up of the chest, which is the thorax, then the abdomen, as well as the pelvis. Then the upper limbs have different regions. They have the arm, the forearm, as well as the palm, and so on. Then the lower limb has the thigh, the leg, as well as the foot and other parts such as the toes. So in anatomy, these regions have their specific anatomical terminologies that are used to describe them. For example, the skull, you refer to it in anatomical terminology as the cranium. The head is referred to as the cephalic region. The neck is referred to as the cervical region. For the trunk, which is divided into three, the chest is known as the thoracic region, the abdomen is known as the abdominal region, the pelvis is known as the pelvic region. Coming to the upper limb, which has got different parts, for example, the armpit is known as the axilla. The arm is known as the brachial. The front of the elbow is known as the antecubital. The forearm is known as the antebrachial. The wrist is known as the carpal. The palm is known as the palmar or the volar region. And then the fingers are known as the digital or the phalangeal region. Similarly, the lower limb also has regions that are given specific anatomical terminologies. The thigh is known as the femoral. The anterior surface of the knee is known as the patella. The leg is known as the crural. The ankle is known as the tarsal. The toes are known as the digital or the phalangeal. The pubic region, the pubis is known as the pubic region, and then when talking about the groin, it is known as the inguinal region. So these are some of the anatomical terminologies that are used to describe the different regions of the body. We can now talk about body planes. What are body planes? These are imaginary flat surfaces that pass through the body, or an organ. The body planes that we are going to discuss include the sagittal plane. The sagittal plane is that body plane that divides the body into the right side and the left side. If a sagittal plane divides the body into equal right side and left sides, if it divides the body into the equal right halves, we call that the mid-sagittal plane. This one passes through the midline. If that sagittal plane divides the body into two unequal halves, we call that the parasagittal plane. This one divides the body into two unequal halves. Another plane is the transverse or horizontal plane. The transverse or horizontal plane is that plane that divides the body into the top part and the bottom part. So you can see this transverse or horizontal plane. Then the frontal or the coronal plane divides the body into the front part and the back part. What you have to understand about these three types of body planes is that they meet at 90 degrees. All these body planes meet at 90 degrees. However, there is another type of body plane known as the oblique plane. The oblique plane is that plane that divides or cuts through a part of the body at any angle other than 90 degrees. Any angle except 90 degrees, and we call that an oblique plane. When you're discussing body regions, it is important to understand that these body regions are studied by making sections. What are sections? A section is a cut through the body or through an organ by any of these body planes, by using any of these body planes. So we study body regions by cutting through them using these body planes. We make sections. We make a cut through that body plane or that through that body or that organ. The organs in the human body are located in any of these two major body cavities. So there are two major body cavities in a human body. What is a body cavity? A body cavity is simply a space that encloses an organ. That encloses an organ, and there are two major body cavities. The one that is at the back, the dorsal cavity, and the one that is in front, the ventral body cavity. These dorsal cavities and ventral body cavities can further be divided into other cavities, as we're going to see in the next slide. So when you're talking about the dorsal cavity is made up of the cranial cavity and the vertebral canal. The cranial cavity, which is formed by the cranial bones. At this point, you don't have to know what the cranial bones are. We're going to discuss them further. Under the skeletal system, contains the brain. The cranial cavity contains the brain and protects the brain. The vertebral canal, which is continuous with the cranial cavity, contains the spinal cord, and it protects the spinal cord. This vertebral canal is formed by the bones of the vertebral column. As we're going to see under skeletal system, we're going to discuss the vertebral column further. For now, it is important to understand that the dorsal cavity is made up of the cranial cavity and the vertebral canal, which are continuous with one another. The two important cavities that we have in the ventral cavity. The ventral cavity, if you remember, it is a cavity that is in front of the body. So the ventral cavity is divided into the thoracic cavity as well as the abdominopelvic cavity. What divides these body cavities into two? It can be a muscle, it could be ligaments, it could be other structures as well. So in this case, the thoracic cavity is divided from the abdominal cavity by this muscular organ here known as the diaphragm. So the diaphragm divides the ventral cavity into the thoracic cavity on top and the abdominopelvic cavity at the bottom. The thoracic cavity is made up of the sternum in front as well as the ribs, and also it is made up of the thoracic portion of the vertebral column. So like I've said, these vertebral column, the sternum, the ribs are going to be discussed under the skeletal system, but those are the parts that form the thoracic cavity: the sternum, the ribs, as well as the thoracic portion of the vertebral column. Underneath, we have the diaphragm separating it from the abdominopelvic cavity. The thoracic cavity is also known as the chest cavity. It is made up of several organs: the heart, the lungs, the major blood vessels such as the aorta, and other organs as we are going to talk about later on, the thymus and so on. They are all found within the thoracic cavity. There are other cavities that are present within the thoracic cavity, and one of these cavities is the mediastinal cavity. So the mediastinal cavity or the mediastinum is this cavity that is present in between the lungs. It's present in between the lungs, or it is present in the central part of the thoracic cavity. It contains several structures. The best example I can give here is the heart. There are other cavities that are present in this body cavity. For example, the pleural cavities, the spaces that are surrounding the lungs. The pleural cavities are spaces that are surrounding the lungs. So there are two. There's the left pleural cavity, which is this part that I'm shading right now, and there's the right pleural cavity, which is this side on the right lung. These pleural cavities have fluid in them. They have fluid in them. But what forms these cavities? Imagine you have the lung here, and this lung is surrounded by a two-layered membrane. What is a membrane? A membrane is just a thin layer of tissue. Thin layer of tissue. Think of it like a plastic bag, right? And this plastic bag, you are pushing down on it. You get a finger or two, then you are pushing down on this plastic bag such that it forms a double layer. It forms something that looks like this. One layer here and another layer there, like that. So these two layers have a space in between them, and this space is filled with fluid. The membrane that is surrounding the lungs and also surrounding the inner aspect of the thorax is known as the pleural membranes. So these two are pleural membranes. If you remember from the previous slides, I mentioned that that layer of the membrane that is closer to the organ is known as the visceral layer, and that membrane that is closer to the wall, that is lining the inside of the wall, is known as the parietal layer. So this is the visceral pleural layer. This one is the parietal pleural layer. In between them, they have a space, and this space is known as the pleural cavity. It is filled with a fluid, and that fluid is known as pleural fluid. So this is what a membrane is, and these are some of the body cavities that are present within the thoracic cavity. If you remember, I'm from mentioning that the mediastinal cavity is another cavity that is contained within the thoracic cavity. If this is the thoracic cavity, at the center of this thoracic cavity, you have the mediastinal cavity. And this mediastinal cavity is very important because this is where you have other structures located in, such as the heart. So that is our heart located within the mediastinal cavity. But there is another cavity that is present within the mediastinal cavity, and this cavity is known as the pericardial cavity. The pericardial cavity is a cavity that is present within the mediastinum, and it is surrounding the heart. So you have our heart there, and this heart is surrounded by this membrane. There are the two-layered membranes, and these two layers of these membranes have a space in between them. They have a space in between them. So there's a first layer of the membrane, and this layer is known as the visceral pericardium. We'll talk more about it under the cardiovascular. And then there's also another layer that is just on the outside here, known as the parietal pericardium. The space in between the parietal pericardium, and the visceral pericardium is known as the pericardial cavity. It's known as the pericardial cavity. So the pericardial cavity, which is the space that is surrounding the heart, is present within the mediastinal cavity. The mediastinum is present within the thoracic cavity. There's fluid that is present in this pericardial cavity, and this fluid is known as the pericardial fluid. There are two cavities that are present on the ventral cavity, the thoracic cavity and the abdominopelvic cavity. The abdominopelvic cavity and the thoracic cavity are divided by the diaphragm. Now, this abdominopelvic cavity is made up of two cavities, and these cavities are the abdominal cavity and the pelvic cavity. So they are continuous with one another. They are just divided by an imaginary line, but they are continuous with one another. For example, if this is our abdominal cavity, this one underneath here is the pelvic cavity. But together they are known as abdominopelvic cavity. So the abdominal cavity contains organs of the abdomen such as the stomach, the spleen, the liver, the gallbladder, the small and large intestines. Then the pelvic cavity also contains some of the portions of the large intestines, the urinary bladder, and the internal organs of the reproductive system. They are contained within this pelvic cavity. There are other body cavities of interest apart from these major cavities that we have talked about, and these body cavities are going to be looked at under each specific system that we are going to discuss. For example, the oral or the mouth cavity is going to be discussed under the digestive system or the GIT. The nasal cavity is going to be talked about under the respiratory system. The orbital cavity is going to be talked about under the nervous system when we are going to be looking at special senses together with the middle ear cavities. Then we also have the synovial cavities that we're going to talk about when we're talking about the joints under the skeletal nervous system. So these are some of the body cavities that we have in the body. This diagram is showing you the membranes that I was mentioning. Remember, the membranes are just thin layers of tissue, and I've said you can think of them like small plastic bags. And this plastic bag has two layers where you are pushing this plastic bag inwards like this with your finger, and then it gets to form something that looks like this. It covers up that finger and then it looks something like this. So you have an organ that is surrounded by this membrane, and this membrane, which has got two layers, that layer that is surrounding the organ is known as the visceral layer. And then there's that layer that is surrounding the body cavity in which this organ is located in, is known as the parietal layer. So the best example that has been given here of this visceral and parietal layer are those that are found in the heart, the pleural membranes, that are found in the lungs, the pleural membranes. You have the parietal pleura, which is surrounding the thoracic cavity, and you also have the visceral pleura that is surrounding the lungs. In between these two, visceral pleura and parietal pleura, you have the pleural cavity where you find pleural fluid. These type of membranes are known as serous membranes. There are different types of membranes that we're going to discuss under the integumentary system, with the integumentary system itself having the skin, which is the cutaneous membrane. But these ones that we're talking about that are present surrounding the organs, and they do not open to the outside of the body, they do not open to the exterior of the body, they are known as the serous membranes. So the serous membrane has two parts. It has the visceral as well as the parietal layer. How to differentiate between the two? Think of it like the word visceral. Think of the word viscera to mean internal body organs such as the stomach and all those. So the visceral layer always surrounds the organ. The parietal layer surrounds the cavity in which that organ is located. This table is showing the different cavities that I've talked about, their subdivisions, the organs, as well as the associated structures. Remember, I mentioned that we have the dorsal cavity and we have the ventral cavity. The dorsal cavity was further divided into the cranial cavity and the vertebral cavity. The cranial cavity has the brain, the vertebral canal had the spinal cord, and these are some of the associated structures that are present in these cavities together with the organs that they are associated with. Then the thoracic cavity, which is part of the ventral cavity, that was divided from the abdominopelvic cavity by the diaphragm. had other cavities as well. The pleural cavity, the mediastinum, and within the mediastinum, we also notice that we have the pericardial cavity, which is a cavity that is surrounding the heart. The pleural cavity was a cavity that was surrounding the lungs. In the mediastinum, we have structures such as the heart, the thymus, esophagus, the trachea, and major blood vessels such as the superior vena cava, inferior vena cava, and the aorta. Then the other cavity is the abdominopelvic cavity, which has the abdomen and the pelvic cavity. In the abdomen, we have major organs such as the stomach, the liver, the small intestine, and the large intestine. And then in the pelvic cavity, we have the organs of reproduction together with the urinary bladder. Now, there are other organs that are found outside this abdominopelvic cavity, and those organs are known as the retroperitoneal organs. They are found outside the abdominopelvic cavity, or they are found outside the abdomen. And the best example of these retroperitoneal organs include the kidneys as well as the associated ureters. We can now shift our attention to the abdominopelvic quadrants and regions. Why is it important to talk about abdominopelvic quadrants and regions? It's because these quadrants and regions of the abdomen and the pelvis, they help clinicians or health practitioners to describe the exact location of the organs that are present within the abdominopelvic cavity. How does a clinician know that the stomach is located in this side of the abdomen, or this pain is coming from the appendix, this pain is coming from the spleen, this pain is coming from the liver? How does a clinician know? It's because of these quadrants and regions of the abdomen that help the clinician pinpoint the exact location of these organs present within this abdomen as well as the pelvic, abdominal as well as the pelvic cavities. When you're talking about the abdominopelvic quadrants, there are 4 abdominopelvic quadrants and there are 9 abdominopelvic regions. We're going to look at how we divide the abdomen and the pelvis into quadrants and how we divide it into regions. So this is important because we tend to draw lines that are dividing these, and most of these lines are passing through the umbilicus or the belly button. So we're going to look at that in the next slide. The abdominopelvic cavity is divided into 4 quadrants by 2 imaginary lines that pass through the umbilicus. The first imaginary line is a vertical line that passes through the umbilicus, and this is known as the median line. The second imaginary line is the horizontal line that passes through the umbilicus, and this one is known as the transumbilical line. These 2 lines divide the abdominopelvic cavity into 4 quadrants: the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. So that now we can pinpoint the exact location of these organs in the abdominopelvic cavity. For example, majority of the liver is found in the right upper quadrant together with the gallbladder. Another example is in the right lower quadrant we have the appendix and the cecum. In the left lower quadrant we have the sigmoid colon and part of the descending colon. And in the left upper quadrant we have the stomach, we have the part of the transverse colon, we have part of the descending colon, we have the spleen, and so on. There are 9 abdominopelvic regions. So the abdominopelvic cavity is divided into 9 regions by drawing 2 mid-clavicular lines that are passing at the middle of the clavicle, vertical lines that are passing through the middle of the clavicle, and we then draw another horizontal line that is passing through the 10th cartilage, and this line is known as the subcostal line, and then another one that is just passing on top of the pelvic or the hip bones, and this line is known as the transtubercular line. This then gives us these 9 regions: the right hypochondriac region, the epigastric region, the left hypochondriac region, the right lumbar region, the umbilical region, the left lumbar region, right inguinal region, hypogastric region, and left inguinal region. Each one of these can be used to pinpoint the exact location of an organ. For example, you can talk about the stomach. Majority of the stomach is located in the epigastric region, the pancreas. Then the left hypochondriac region, you have the spleen. Then the right hypochondriac region, you have some parts of the liver, the gallbladder. The right lumbar region, you can think of the kidneys and so on. So it is very much important for you people to go and check out the major organs that can be found in these regions. The other example I can give is right inguinal region is where you find the appendix. The hypogastric region, you tend to find the urinary bladder. The female reproductive organs can be located in this region as well. So it is important that you take time to look through the major organs that are found within these regions. So these two diagrams are just comparing the quadrants to the regions. So just take time to look at the abdominopelvic quadrants as well as the abdominopelvic regions. With that, viewers, we have come to the end of part 3, which is the final part of the introduction to human anatomy and physiology. Make sure you check out part 1 and part 2. Please do not forget to subscribe, to share, to like, and comment, and turn on your notification button so that every time I post a new video should be updated. I am Dr. Said Piri. Till next time.